Good afternoon, lovely viewers. You're welcome to Kids Paradise. Kids Paradise is a show that always has its viewers at heart. So we discuss topics relating to the well-being of our members, and today our topic proves just that. So today we're going to be discussing the role of a child during emergencies. When you witness an accident as a child, or you see someone choking, or any kind of emergency. So now our guest, as I said, our guest is the head of the police ambulance service. Okay. Hi. You're welcome to Kids Paradise.
No, thank you very much.
Okay. So if I call Uncle Yaws, that's okay, or
no problem. For the sake of the program, you can call me Uncle Yaws. But I'm the head of policy.
You're the head of policy. Okay.
National Ambulance Service.
Yeah.
When you have a cat, the best thing you need to do is to just have, because something direct pressure. If you just place your hand on the where the injury is, and if you have maybe a gauze, you just play the gauze there, and you get a gauze bandage, and you just bandage it. So you're just doing that to put pressure on the injured part so that the bleeding will stop. So that is the best way to manage a cut when it comes to, unless maybe the person is bleeding profusely. We have something we call tourniquet. Let's say if it cuts a vein, it cuts an artery, and it's a major artery, and the person is bleeding profusely, and even if you place your hand there and still the bleeding is coming, all you need to do is to just place something like a tourniquet. So you tie just before the injured area, so you tie it around there so that at least it will stop the bleeding. And one thing you need to also do, when you put a pad on the injured, let's say you put a gauze on the injured place, don't remove it. Just keep adding to it, because immediately you move it, you aggravate the injury. Then the blood will start coming again. So you need to always make sure that you pad the place more and just tie around the area.
So with my situation, as I was saying that, and the fire, it caused fire. Before I quenched the fire, and the oil from when he was preparing the indomie, it spilled on me. So when it spilled on my hand, then after I quenched it, I was feeling the pain. So I used water and then salt on it. Is that a right way of treating such issues?
Using the water and salt, you could have used just the water. What you do is it bends, so it's heat bends. So what happens is you need to flush the area with water. So you just place your hand under the running water. You let the water run on the side for about 10 to 15 minutes. Then the pain will subdue. Okay. So that is the best way to manage. Don't use any hard clothing to just brush off the place. If you do that, you just peel the skin off. So it is appropriate that you let running water run over the site to be able to calm there.
Right now we are going to do the demonstrations where our personnel from the ambulance service will help us with some quick tips to administer to anyone who is suffering from. Okay, so but before we go to that, let's introduce our second guest, who is there. Uncle, please make introduce yourself.
My name is Savannah Sofia Boko. I'm the station manager of Atomic Ambulance Station.
Okay, so you'll be helping us with the demonstration. So please, can you take us through what we are going to do today, right now?
Thank you very much. I'd like to use this opportunity to say hello to the management of National Ambulance Service, especially the CEO and the PR units, for giving us this opportunity.
And please, can you speak up so our viewers will hear you?
To giving us this opportunity to come and demonstrate this particular knowledge for our younger brothers and sisters. So, as earlier discussed, in any emergency situation, you need to be very calm, very composed, and very alert. So let's say you meet your dad or your mom lying down, prostrate on the floor like this. First of all, there is this acronym that has been coined to help us to remember what to do when there's an emergency. It is DRABC. So the D stands for danger. You need to size up the scene to know whether there's any potential danger around. Let's say you meet someone on the middle of the road who needs help. You can't just go onto the middle of the road to give that help. You need to make sure that the person is brought from the middle of the road to a very safer place. The R stands for response. So you need to check for the response of your casualty. The A stands for airway. The airway, you need to practically open the person's or the casualty's mouth to see whether there's any blockage or any object that is obstructing the person's airway. The B stands for breathing. So you need to practically look at the the rise and fall of the chest, or you listen for breath sound or feel for breath sound. And C stands for circulation. So as we earlier discussed, when there's an emergency, you need to be very calm because you may be the bridge between the person going to his early grave or the person surviving.
Yeah.
So we take it through a very practical session.
Please, can we dive right into the session?
Okay. So in every emergency situation, as we already talked, the DRAB, but in a situation where it's CPR, it is CAB. So we take it through a very simple demonstration to equip you what to do when there's an emergency. So I come to the house, I see my father or my mother lying down like this. First of all, I need to check whether the environment is very safe for me to administer my first aid. Now the environment is safe. So, well, what I'll do is I'll call for help. So I'll shout for help. That is drawing other people attention to come to.
Cloud, please pull the mask closer to.
So I'll shout for help, calling other people's attention to come and assist me.
Pull the mask closer.
Okay. So someone has come. I would instruct the person to activate the emergency system. That is called the 112. Yes. So I'll go and check for a response of my casualty. So what I'll do is I'll tap the person's shoulders. For the purpose of our training, this mannequin will be called Joe. So Joe. There is no response.
Yes.
So I'll call for help. Help us, right? Then
People like entertainment, yeah.
I'm going to check for the circulation, that is C. There's something we call the parotic pulse, which is just at the neck of the patient. So you use your 2 fingers to check where, check if there is no pulse.
I'll come to do it for the
start your immediate CPR. So I've checked, there's no pulse.
How would you know there is no pulse?
So you use your 2 fingers, you place it between your Adam's apple and the muscle.
Okay.
So you place it there. If there is pulse, you hear the heart beating.
Yeah.
If there's no pulse, there wouldn't be any beating. So I check, there's no pulse. I want to listen for breath sounds and also look at the rise and fall of the chest. So there's no rise and fall of the chest, there's no breath sounds. I start my immediate CPR. So with the CPR, you need to know which hand is your dominant hand. So I am a right hand person, so I place my right hand. Make a cursory look at the person's chest. You draw the sign of the cross at the middle of the chest. So I place my hand, that is the heel of my palm, at the middle. I interlock it with the other one. I get closer to my patient, then I start my compressions. The compressions is 30 chest compressions to 2 rescue breaths. So I start, so 1, 2, you need to press very fast and deep. The depth is 2 inches or 4 to 5 centimeters deep. So it's like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And you're doing your compressions. You need to allow the chest to recoil, to allow blood to flow back to the heart. So that when you press the heart, you press the heart against the bone for the blood to circulate to the other part of the body. So So we start the CPR. I'm going to count 30, and my other colleague will give the 2 rescue breaths.
Okay.
So we are started 1,
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And he will
Okay,
give the
so
rescue.
I'll just give the rescue breath. And in giving the rescue breath, if the patient doesn't have any spinal injury, you can tilt the head like this. Then you just blow the air. 1.
So in giving the rescue breath, you need to see the rise and fall of the chest.
Chest.
So
The
okay.
chest has to rise and fall. If
Okay.
the chest doesn't rise, it means you're not doing it.
Oh, okay.
And in our settings, with the professionals, we call this thing valve marks.
Valve.
Yeah. In our settings, we will have it. But in the settings of, let's say, the school,
Or
the
house.
church, the house, you will not have this. We have something we call the disposable face shield. So you just place this on the mouth of the patient, then you just go like this and blow. As you blow,
The chest needs to rise.
Is this what they
Before
call
the-
mouth to mouth? You know, some people.
yeah, this is
Yeah,
called
this is
mouth to mouth.
But this,
Okay.
you're using a shield.
There's
Yes.
a one-way valve shield, so
Okay.
you can use this and you will not be exposed to. But in an environment where you don't have this and the patient is your relative, I don't think doing direct mouth to mouth will spoil anything, because you need to make
Yeah.
sure that your relative is alive. So
Yes, very true.
we encourage that if it's a relative, make sure you do it. In a situation whereby you don't have any of these, and you cannot give the rescue breath, let's say it's not a relative, the person is not a relative, so you are scared of any
Yeah.
exposure, you don't want to give mouth to mouth, all you need to do is you continue with just do CPR.
Okay.
You just do CPR. I'm laying emphasis on it. If you cannot give rescue breath because you don't have any of the apparatus that you need to do the rescue
Okay.
breath,
Yes.
you just continue with your CPR.
Okay,
But you've
so-
activated the EMS. So
Yeah.
Okay.
the EMS, when they
Right.
come over, they'll
Okay.
just also continue with the care.
Okay, so can we quickly move to the baby now?
The baby. So before we move to the baby, the chest compression and the rescue breath, you need to do it for 2 minutes. That is 5 cycles.
Okay.
After the 5 cycles, you check for pulse, check whether there's any sign of life in the person. If there's no sign, you continue with your CPR till help arrives.
Okay.
So with the baby,
And to lay emphasis on with the adults, when you're doing the CPR as well, we have something we call AED.
AED.
AED, automated external defibrillator. You need to, when you finish with your CPR, 1 cycle, then you attach you've called for help. So
Yes.
immediately the AED arrives, you quickly need to what? Attach the AED. It will tell
Okay.
you whether there is a need for you to continue CPR or there is a need to shock to revive the patient. If it
Okay.
indicates shock, you tell everybody to clear off the patient so that you'll be able to what? Shock the patient.
All right. All right.
so with babies, they have a very smaller chest
Yes.
and they have a very fragile bones and all that.
Yes.
So with babies, you don't use your 2 arms. You either use your 2 thumbs to do your chest compressions. And with babies, it is 15 to 2 rescue breaths. That is 15 compressions like this
Okay.
to
15 times.
15 times, then you give the rescue breath. If it is your own baby, you can do mouth to mouth. Or whether if you have any of these apparatus, you use them to
Okay.
give the rescue breath.
Okay. So now, what if the child is choking? What will you do to help the child?
Yes, if the child is choking, that means there's something in the mouth of the child. You need to hold the baby like this,
Listen.
in your palm like this, his face pointing down. Then you make a tap at his back. So you push it like this. Whatever
With
it
this
is.
part?
Yes, with this part.
Okay.
You hit it.
This
You
thing.
hit it. Whatever is in the throat or the mouth will just be dislodged onto the ground.
Okay.
Maybe
And
if
with
it's
adults, when the person is choking, we have something we call the abdominal thrust or the Heimlich maneuver. You stand behind the patient, you rub your hands,
Okay.
then you thrust upwards. You stand behind your casualty or your patient, you rub your hand around him, then you guys have what? Whatever it is,
The
force to come.
okay.
Okay, so thank you so much for this demonstration.